Hi guys, welcome back to my channel. To my new subscribers, thank you for joining this platform. Here, we talk on faith, principles, and medicine. It's Black History Month, and to me, Black History Month is where we celebrate the accomplishment of great men and women who came from the African continent and are inspiring the world one day at a time. Here with me today is my brother, the man that shares my DNA, Acquah Jr. You'll be seeing him shortly. We'll be talking more about things in nursing, how he started as a CNA and now a nursing practitioner. If you're new here, don't forget to hit that subscribe button and click the notification bell so you don't miss any new video. My name is Dr. Frederick Acquah. Currently, I'm a third-year internal medicine chief resident in New Jersey. I hope you find this video informative. Let's go. Welcome back. So to do the honors today for our Black History Month video, I'll be welcoming my brother, Acquah Jr. Yo, yeah. So this is the man right here. This is my brother. You know, he means a lot to me. And you could see, you know, he's light skinned, he's better looking than me, you know. But when we come to bench press, you know, maybe I might beat him.
You never know.
All right. So as we're in Black History Month, celebrating Black excellence and achievement, I'd like to take the time and congratulate my brother, you know, on achieving his master's in psychiatry. One day you need someone with the mind, things of the mind, you know who to call. All right.
Thank you.
Yeah.
Thank
Congratulations. Congratulations. All right, so today I would like us to take a step back, and in the field of nursing, there's a hierarchy of degrees that you can get. So when we came into this country, into the United States, my brother did it so well that, you know, I want him to share his story with us. So the young immigrant or the one watching us today who has not made their decision yet on what they really want to do in the field of nursing. You know, so he started as a CNA and went all the way up, and now he has his master's. So I'll open the platform for him. He'll introduce himself, his way, his style, and then we'll go into it. All right. So it's all you now, bro.
All right, Dr. Acquah, thanks for having me. I've been wondering why it took so long for me to come on this show. And finally, I'm here.
Today's the day.
I'm here to share my story with the rest of the world and anybody willing to go field in healthcare.
All right.
So my name is Acquah Jr. Currently a graduate of psychiatry. I attained my master's recently in psychiatry, and looking forward to taking my boards or my certification to be a psychiatric nurse practitioner.
Nice.
Where I'll be able to take care of people with mental health issues. And as we know, in the days that we live in these worlds, mental health is one aspect that people don't pay attention to. So having the opportunity to better my education, attain new knowledge, is going to help me help others even better. Like you said, my story began over a decade ago, migrating from Ghana, West Africa to the United States. Healthcare wasn't one aspect that I was leaning towards, but it was something that was introduced to me and fell in love with it at first sight. My main goal was to go into civil engineering, the construction world and all that.
Yeah.
But I guess when you talk to God, if you're religious, He has a different way of changing your life that sometimes you don't have to fight it, you just have to let it happen. So I went into healthcare, started as a CNA, certified nursing assistant. And the duties of a CNA is to be the eyes and ears of the nurse of the unit. So in a typical day of a CNA, you come in, you assign a couple of patients to care for, and you help the patients with bathing, feeding, ambulation, turn and positioning. Doing CNA, I observe the nurses on the unit, and I kind of see that I have that love or interest on being at that level, because I was never satisfied with what position I was in at that time. So I inquired more about becoming a nurse, got into some community colleges where I had to be put on a waiting list, and thinking that healthcare nurses are much needed in this world, you would think there will be a lot of seats available to train these young aspiring nurses. Fast forward, I got into a private LPN school, which is licensed practical nursing. I took it for a year. And being a licensed practical nurse, it's a little bit short of being a registered nurse. Very limited in how much care you can provide to the patient. Aspect, you can administer medications, but not all medications. You can administer certain IV medications, and you can do certain teachings to the patient. You have to defer all that to the registered nurse. So seeing my potential and knowing that I could do more and be available and give more to the patients, I was able to further my education in becoming a registered nurse, where I studied for 2 years, trying to bridge from the LPN to the RN, which is extra advanced knowledge in the anatomy and physiology, pathophysiology, pharmacology, and health assessment. I graduated that, took what we call the NCLEX, the RN NCLEX, and I became a registered nurse. I did that, working with patients, working with physicians, working with family members. I kind of saying that I can still do more.
The main thing that I'm happy about is we all have this thing called potential, you know. I'll leave a link right here. There was a video that I did on potential, and you know, he saw that being a CNA wasn't enough. You know, he felt that he could do more, and he gradually went up. Even being an RN, he felt that he could still do more. You know, and now, you know, you have the NP.
Yeah. So just to add to that, so now being having my master's in psychiatry, I can care for patients with mental health issues. Be that psychotherapy, being prescribing psychotropic medications to help with i.e. depression, schizophrenia, bipolar, substance abuse, the list goes on. I kind of seen that area, I had that need, and also nursing is kind of like a bag of trail mix. You never know what you're gonna get. Once you have that education, there are a lot of doors it's going to be open to you. So having your master's degree, you can also go into academia and teach other people aspiring to be nurses. The nursing field is very fulfilling. You have to have the passion and the ability to have an open mind, the ability to stretch your imagination and to be creative. Because there's no one way of caring for patients. How I treat one person might not be the same way I'll treat the other person.
Very proud to call him my brother. You know, while doing all these things, trying to earn these degrees, he was still working full time. You know, 2 jobs, 3 jobs. I don't know how he did it, you know, but the main thing is that he made sure that his home was stable. I'm proud of him. Now, can you walk us through what a typical day is like for a registered nurse, for instance?
Depends on the specialty you're working, but typical day routinely for every nursing unit, you come in based on the shift, morning or night shift. So 7 a.m. you walk in, you get a report from the night shift. Everybody is assigned a set amount of patients. So if your grade, which meaning the nurse to a patient ratio, whatever it calls for, you get your list of patients, 5, 6, 7 patients. You take your report. You prioritize which patients you're going to see first. You're going to see somebody who was admitted or somebody after surgery, or on the psych unit, you're going to see a patient who was in restraint or a patient who was feeling suicidal. That needs to be you have to do a quick assessment on them before you see everybody else. Once you do that, you go through the patient's chart individually and see who needs the doctor's attention. After that, you decide if you have any admissions, discharges, you prioritize that. You do your patient education in between and you do your documentations. You will make sure you take your breaks as assigned, because on a typical hospital or nursing unit, it's kind of challenging to find time to take a break for yourself. So having that moment, 30 minutes, 45 minutes to yourself is very key to keep you refreshed and back to work to finish your shift. And once your shift is about to be over, you make sure you put your notes in, you put in reports for the next shift, and you come home to your lovely family, rest up, and do it all over again.
Nice. To the young person watching us, to the immigrant who came to this country trying to decide what going to IT, should they stay in the medical field, should they do nursing? What would be your advice to the person watching us today trying to decide whether to go into nursing or not?
Okay, well, that's a good point. One of my favorite quotes from Walt Disney, if you can dream it, you can do it. So regardless of what field you want to go in, what career you want to set, if you want to do nursing, it's a very fulfilling career. So just dream big, put your mind to it, stay disciplined, stay focused, and know that the sky's the limit. There's not much you can do by yourself. Always remember you have a support system. Lean on your families, lean on your friends, your co-workers, and have an open mind, and always remember you can learn new things.
Yep. All right, so I see this painting right behind me.
Oh,
you want to tell me something. Tell me what's going on here.
You never want to forget where you're coming from. So you always have to have a depiction of something in the background, always hinting at you, saying that, hey, the sun may rise today, and by the time the sun set, make sure you have a plan in place.
Wow.
And if it's been executed, then hey, hallelujah.
Nice.
All right.
Nice.
Yeah.
All right, guys. So we coming to the end of today's video. For everyone that visits this platform, I give them the chance to give a shout out. Big bro, you gotta give someone a shout out today.
Yeah, well, thank you for having me on your channel.
Yeah,
I mean, it's been long awaited, interview, and I'm appreciative of this moment. Thanks to the man above, my dad, old man Bebe, for teaching me the life lessons that I'm able to utilize today. Doreen, she sacrificed a lot for us to be in this position. Although she's working in the background, not many people know about her, but we hope to have her on this channel one day. Also, I'd like to thank my kids, understanding that I need to further my education to have a better life, for them to be able to have the best of life they can get. And lastly, I'd like to thank my lovely wife. Without her, I wouldn't be as sharp and disciplined as I am.
Nice.
She makes sure I'm on my tippy toes, and everything is held accountable or accounted for.
Nice.
And to anybody that had an influence in my life, my career, and where I am today, I thank you. The names are endless, and we might need another filming to mention everybody's name. So thank you.
I'll be adding this one to the playlist Family Corner. So there'll be more family videos coming up shortly. So stay tuned. If you enjoyed this video, don't forget to give it a like. And I'll see you in my next video. Shalom.